Hey there, John Cummins for your CMO Byte. This one is on stress echoes versus exercise ECGs. So fundamentally, you do an exercise ECG primarily to exclude myocardial ischemia. What you're looking for is ST segment depression. Now, the sensitivity is about 70%, so you'll miss 30% of coronary artery disease because it's a very inexact test, and obviously the miss rate, the error rate is lower the higher the probability of coronary artery disease. So if you get a diabetic smoker with classical angina, then the miss rate is going to be a lot lower. You can boost that 70% to about 85% with a stress echo, and what you're essentially doing is looking at the left ventricular contraction at rest, get someone to do exactly the normal exercise stress test. Everything is exactly normal. At peak exercise, you drag the person off the stress test machine and repeat the echo, and you're looking for impairment in ventricular wall contractility. It could be the left ventricle, could be the right ventricle, which would correlate to a heart that just isn't pumping as well. So when we look at a stress echo report, they will comment on the ECG changes. But for all intents and purposes, you can ignore them, and this is the key message, because you're not looking for ECG changes. You can do a stress test for that. What you're looking for is a change in wall contractility, and that's by observation, so it does have an error rate. There is an inter-observer variability, but the bottom line is what is actually happening to the ventricular wall, left or right, corresponding to certain arteries that feed those ventricles, and does it reflect a change from rest that would suggest ischemia. Now, if they've not had a stress test before, yes, it would be good to basically have the ECG changes corresponding to that region as well, but the key is actually what is happening with the echo component of that test. And so occasionally I get fed or a question around, look, the echo part looks fine, but they've got the ECG changes. But my view is if the echo part is fine, ignore it. It is basically a normal stress echo. Hope that helps, and hope you have a wonderful week, and we'll see you soon.